Hi, Dr. Brad Conder here. I want to kind of cover a subject that's going to be really hot and heavy for the next couple months and might be something that really jumps us forward, which is telemedicine. In the light of this coronavirus pandemic, I do think it's going to change how we consume healthcare, how we consume information, how we actually just go about our daily lives during this time of year when these type of things will most likely crop up maybe in the future. So I think getting used to telemedicine is going to be very important. We've kind of already been doing some of it already. So basically what it is just, I'm not sure exactly where the word tele came from as far as adding it to medicine, but basically it just means like a virtual appointment. Mostly we're describing it in the form of video. Video has really been able to take off as far as like how people can even access videos as far as their phones, tablets, and computers. When it first came out, you had to have a lot of big equipment just to be able to do a telemedicine visits. So doctors were rolling it out, but oftentimes it was for very rural areas, not too much on a kind of a grand scale. But I think this is going to really push it forward. So what I would suggest as far as telemedicine is that you're going to have different forms that you can use it on. You should be able to do it on your phone. Most platforms are going to be able to do it through a browser or through an app. Really what I would suggest is the first thing you need to do, as far as your doctors, you need to call them and see if they have it available, and they'll tell you how you access it. Oftentimes you may even have insurance that's already giving you cards or giving you ways to access it as well. You need to look at those as soon as you can and start playing with them. Start trying to get used to the visits and how they work. They're really not that hard, but a lot of times if you're not used to it, you might avoid it because it's a hassle. But most of us should have time to really do that right now. Like as far as like for us doing telehealth visits, physical therapy, a big part of what we do is the evaluation, the consult, the information. So that's easy to do online on videos. But other telemedicine options are like phone calls, texting, emails. That's actually kind of a form of telemedicine as well. It's just we're not as used to calling it telemedicine, even though that it is. Mostly it's going to be videos. So right now, I would kind of take advantage of this time. If you are sitting at home, look at your resources that you have as far as your health insurance cards. A lot of times they have these options. Call your doctors, email your doctors, ask them what options they have. Even if you don't need them, go ahead and figure this out and kind of see how easy it is to kind of do it. Your doctors in particular do have processes in place to do this. Physical therapy can be a little different as far as like from state to state and what access each individual clinic has to it. We have rolled this out for a while now. I've been doing it myself. All of our videos are HIPAA compliant. They come through our electronic medical records. All we have to do is have send a link to somebody via email or text, and they get to log on, and we get just to talk and do a full visit just like we would do here. Of course, we can't do them like manual therapy. We can't do dry needling, can't do things like that, but I can always still give the good advice. I can watch you do some natural tests, range of motion. I can usually figure out what's going on with you with just a video. And then actually I can give you a lot of self-care. So how do you take care of yourself? How do you stretch? How do you move? And then lastly, exercise. Exercise sometimes maybe I've been giving people exercises, but you're responsible for doing them at home. This is a way for me to kind of help you do more exercise at home, get more out of your therapy sessions. So I think it's going to be a good option. I'll probably talk more about how we're doing it specifically in a different video, but for today I just want to kind of give information on general telemedicine. Hopefully you're taking advantage of it with this coronavirus pandemic, because it's going to be something that's going to be very needed. Be patient with it, because even though you have time to figure it out, your doctors are also trying to get it figured out as well. So look into it. I think it's a good thing, and be safe, be healthy, and I hope everyone gets through this quickly and safely.